Hello, everybody. Welcome to the ACI Alliance webinar, and I will be handing this over to our moderators.
Welcome to our ACI Alliance Tuesday Talk. This webinar is being recorded. We are your moderators. My name is Elisheva Williams, and I have two daughters that wear cochlear implants, ages 8 and 13. And although this has been a long journey, we are forever grateful for this technology. So that's why I'm here.
Good afternoon. My name is Hannah Brown. I am also a third-year doctorate of audiology student at the University of Kansas Medical Center. I'm also a bilateral cochlear implant user myself.
And this talk is a part of an ongoing series for parents, adults with hearing loss, family members, and others. As members of ACI Alliance Advocacy Network, CI CAN, we hope you learn from this session and consider getting involved in the work of ACI Alliance. Next slide.
First, let's review the technology and go over the Zoom settings that will help you. To access the closed captioning, first click on the settings and the navigation panel at the top of the screen. Then under the meeting tab, verify that the closed captions should be enabled. If not, toggle to enable it. To ask a question, use the chat box and type it in. Next slide.
American Cochlear Implant Alliance is a unique organization focused on CI across the care continuum. We were founded because it was felt that cochlear implants fall through the cracks at other hearing health organizations, and we wanted to focus attention on improving access to CIs. The mission of the ACI Alliance is to support research, advance awareness, and advocacy. Next slide, please.
CI CAN. CI Consumer Advocacy Network is for adult consumers and family members of recipients, including parents, aimed at enhancing and enlarging the broader advocacy efforts with firsthand knowledge of cochlear implants. Personal stories make the difference in impacting decision makers and adds credibility in our contacts with the state and federal representatives on key issues. If you are interested in learning more, please let us know in the chat box, and the ACI Alliance staff will follow up later. Next slide.
We also wanted to share a few of the ACI Alliance website resources that are available. Next slide, please.
And now we are delighted to introduce our featured speaker today. Dr. Smeal is a clinical audiologist and researcher in the Division of Audiology at the University of Miami. She is also an assistant professor here. Dr. Smeal practices as a clinical audiologist specializing in cochlear implants, auditory implants, and single-sided deafness. She also works in genetic hearing loss research labs, specifically supporting studies in the areas of implantable device outcome relative to genetic hearing loss. Dr. Smeal has led and participated in several subcommittees focused on clinical quality control. She was the first postdoctoral clinical auditory implant fellow at the University of Miami Ear Institute. Dr. Smeal is involved in National Audiology Organization and is an active participant on associated committees.
All right, thank you guys so much for the introduction, and thank you to the American Cochlear Implant Alliance for asking me to come and speak about this today. As the moderator said, my name is Molly, and I'm an implant audiologist at the University of Miami, and I'm so happy to be here today talking about this topic that is very near and dear to my practice, which is what happens during a cochlear implant evaluation for adults. So, you've been referred for a cochlear implant evaluation. Now, being referred for a cochlear implant evaluation can bring a lot of feelings and emotions, and it usually means a couple of things. Number one is that you've likely been diagnosed with hearing loss at some point in your lifetime, whether that be a long-term hearing loss that you've had since childhood, or maybe a very recent hearing loss that occurred suddenly. You've likely seen an audiologist and had a hearing test which revealed some degree of hearing loss. And with that, you may have also been recommended to try hearing aids. And if they referred you for a cochlear implant evaluation, it's likely that you might be struggling with those hearing aids or feel like they're not giving you the same amount of benefit that they used to. And so with that and being referred for the cochlear implant evaluation appointment, it can lead to a couple of things and different feelings like maybe anxiety. You might be feeling confused about why you're being referred for this device. With your hearing loss, you may be feeling things like sadness, anxiety, or depression because you've had to withdraw from maybe social activities you used to enjoy participating in. You may not be able to engage with your family as much as you'd like to. And so all of that leads to a lot of emotions and feelings and being referred for the surgical device when you've used hearing aids maybe successfully for many years. So today we'll talk about the whole referral process and what that looks like. But first we'll start by talking about what does it mean to have hearing loss that necessitates a cochlear implant referral. This is an example of an audiogram, and this likely looks familiar to a lot of you. Essentially what this is a graph of how somebody hears soft sounds. Across the top are the different pitches or frequencies of sound that we test, from low pitch up to high pitch, laid out like a piano. And down the left-hand side is how loud a sound would have to be for somebody to hear it, from very soft at the top all the way down to very loud at the bottom. We typically consider normal hearing to be anything around this 25 line here and above. The circles on this graph represent the right ear and the X's are the left ear. And so when somebody has significant hearing loss, they're going to miss a lot of important sounds that we use in our day-to-day communication. And an easier way to look at this is looking at this graph that shows the hearing test with some speech sounds. And so you can see here in this yellow region are a lot of the sounds we use to communicate in our day-to-day. And if somebody had a hearing loss like what I showed in the last slide, they're going to be missing all of these sounds that are in that orange shaded box. And so we can see that that would cause a lot of difficulty in day-to-day communication, and especially when there's noise in the background. Now, typically when somebody has a hearing loss that leads to a referral for a cochlear implant, that type of hearing loss is called a sensory neural hearing loss. And what that means is that there's some type of impact or damage to the cochlea, which is your organ for hearing. And that's this blue sort of snail-looking structure here. With that type of hearing loss, sound is going to travel to your ear and to your cochlea, but when it reaches that cochlea, typically some of the cells that are in it are either damaged or maybe missing altogether. And as a result, when sound passes through that cochlea to the hearing nerve, it often sounds a little bit distorted or maybe unclear by the time it arrives to your brain. Now, in the real world, what this might look like is having difficulty communicating either one-on-one or in those noisy background types of situations like restaurants or parties. So you've probably all been in a situation like this where you're at a crowded restaurant with a group. There's probably music playing in the background, and usually these restaurants are very large open rooms where there's a lot of room for sound to bounce around. Typically, there's the sound of silverware and dishes clanking. There might be a child crying at the table behind you. And as a result of all of these different sounds and noises, typically when you have hearing loss like this, it makes communication really difficult, even with the person that's just sitting across the table from you. Traditional hearing aids are usually the first step that we try when somebody has hearing loss. And what they're doing is just taking sound in your environment and trying to make it louder so that it's easier for you to hear. But in cases of really significant hearing loss, like we showed on that hearing test, typically sound is going to come in a little bit louder, but it may not necessarily be clearer or easier for your brain to understand, because now that organ is kind of acting like a broken speaker system. Now, I don't want to pose this that a cochlear implant is in any way a last resort option, but it is very common that you'll try hearing aids as a non-surgical option first before being referred for a surgical option like a cochlear implant. Now, the good news is with this type of hearing loss, if you've been referred for a cochlear implant and you're experiencing this process right now, you're not alone. The World Health Organization predicts that the prevalence of significant hearing loss is going to continue to rise over the next couple of decades as our population continues to increase, and particularly our population of older adults. At this time, it's estimated that 1.5 billion individuals live with hearing loss in the world, and that number is projected to increase, particularly for those who have disabling hearing loss that may require them to come in for a cochlear implant evaluation at some point. So you can see here that by the year 2050, it's estimated that 711 million individuals will have some form of disabling hearing loss, which is a really staggering number. And whether individuals are referred for cochlear implants or hearing aids, what we're seeing is that in general, the number of individuals using devices for their hearing loss is relatively low. On average, anywhere between 2 and 12% of individuals who could benefit from a cochlear implant go on to receive one. So there could be anywhere from 90 to 98% of individuals walking around who could benefit from this technology that are either not referred for it or choose not to proceed. And so we're seeing that in general, hearing loss treatment options are globally underutilized. Now, if you're being referred for a cochlear implant evaluation, there are a lot of benefits to cochlear implants, and there's been a lot of research to show that. So I don't want you to feel discouraged that it is some type of last resort option. It's really great technology for those who are candidates for it. There was a study in 2020 of patients with Medicare insurance that showed on average a 53% increase in speech understanding with an implant when compared to a hearing aid before they got the implant. And even further, a study in 2021 that looked at 400 cases showed really significant improvements in speech understanding with both individual words and sentences, and even sentences in those background noise situations, which are really often a complaint from our patients who have significant hearing loss. So there's a lot of encouraging research out there, and we see in our day-to-day clinics that cochlear implants are really amazing technology for those who are candidates for it. There's also a lot of research to suggest that being referred for a cochlear implant earlier is actually better. And so if you're being referred, it's a good idea to go in and undergo that evaluation to see if you meet candidacy. There are a lot of factors that play into how somebody will do with a cochlear implant, including things like age, how long you've experienced your hearing loss. And we see that these factors, although they maybe don't account for all of how somebody will do with an implant, do play a really important role. And so we want individuals to come in sooner for cochlear implant evaluations so we can get you access to better hearing as quickly as possible. Now, over the past couple of decades since cochlear implants became available, the candidacy has changed quite a bit. This hearing test, which shows severe to profound hearing loss, is more traditional of what a cochlear implant recipient may have looked like several decades ago, and typically patients were only able to get one cochlear implant at that time. But the good news is now you can be evaluated to have a second cochlear implant if you're a candidate in both ears. So you're no longer limited to just having one implant. We've also seen that patients who have even normal hearing in those lower pitch sounds can benefit from a cochlear implant. So you no longer have to have severe to profound hearing loss to qualify. And the candidacy have recently expanded to even include patients who have what we call single-sided deafness, which is when you have normal hearing in one ear and significant hearing loss in the other. And so we're really able to get this amazing technology out to more people. And so I encourage you, if you think you may be a candidate or you've been referred for the evaluation, to go in and learn more about that. Navigating the CI candidacy and referral process can be confusing, and likely if you've been referred for the evaluation, you may have started doing some research on your own, and you're going to come across a lot of terms that are kind of confusing, like you may read bilateral, electroacoustic, and navigating this can feel overwhelming. But I want to encourage you that your audiologist and your surgeon will work together to determine if you're the right candidate and walk you through that process and make it very clear to you what the next steps will be. The CI evaluation has changed a lot since our candidacy criteria have changed. Historically, there would be a medical workup with an ENT. They likely will order some imaging, and then you would have your audiology exam. But because we know a lot more about these devices and a lot more about how your individual lifestyle plays a role in candidacy, the evaluation process might look a little bit different. They may run genetic testing if you have a family history of hearing loss, because that could tell us some about how you will do with the implant. They may also give you some questionnaires about your quality of life so that there's a better understanding of how your hearing loss is impacting you in your day-to-day. So just expect that in going through this process, you may do some things that you weren't necessarily expecting, but all of this together is helping your audiologist and your surgeon to determine if you're the right candidate. Now, in an ideal world, this is what a cochlear implant evaluation and referral process would look like. Typically, you would have your hearing loss diagnosed by audiology, and likely you'll have an evaluation with an ENT physician at some point so they can complete a medical workup of your ears. If you're a candidate for them, they're going to refer you to try hearing aids. And for a lot of individuals, hearing aids are successful for a long time. But at some point, you may notice that you're starting to struggle with your hearing aids and not doing as well as you used to. And so you might go back to your ENT or your audiologist to inquire about other options. And they'd refer you for that in-person appointment where they would say if you meet candidacy so that you could have the surgery, or if not, maybe you could try new hearing aids. But in reality, this process can be a little bit more confusing and time-consuming than this would show. So this is a graph that shows a typical cochlear implant referral process. And if you're going through this process right now, you may be experiencing some of this confusion, and there's a lot of different appointments that you'll go through. And we understand that this takes a lot of time and a lot of travel for our patients. And so rest assured, we are trying to make this process more streamlined and easier so that we can get more patients access to this technology. As you go through this referral process, you're going to meet a lot of different people in your journey towards getting a cochlear implant. And the teams can be really large and expansive for cochlear implant programs. So this is our hearing implant team at the University of Miami, and you can see there's a lot of different individuals that play a role in this process. So I'm going to talk through what each of these individuals' role is in going through the cochlear implant evaluation. The physician or ENT that you'll see is the surgeon that's going to be responsible for actually performing your surgery and putting the internal implant in place. Some teams also have groups of researchers and engineers who are working on the actual devices and pushing the field forward in terms of research. Your audiologist that you meet with is going to be the one that actually programs your device and maybe does some testing on the device after you've had your surgery. Most programs also have a clinical support team, and in our program, this group is really critical for actually getting you to the day of your surgery because they're dealing with submissions to insurance, scheduling that surgery, and any other type of device ordering along that process. And then a lot of programs will also have a support team that maybe does some of the rehabilitation after you've had the surgery or helps with interventions in terms of things like psychology and social work. So now that we have an understanding of who you might meet along this process, we're going to spend some time focused on the actual cochlear implant evaluation that will be done in person with your audiologist. This appointment has a couple of different key components that your audiologist will be trying to achieve. And the cochlear implant evaluation appointment itself can last anywhere from 90 minutes to even 3 hours, depending on what center you go to and what their specific protocol is. And so we'll talk about each of these components in more detail, but really what the audiologist is trying to do is get a sense of what it is that you're looking for in seeking the appointment, and then do some testing to determine if you are a good candidate for the cochlear implant. The first part of that appointment will be sort of an interview style where the audiologist is going to gather history about your hearing loss And then they may also give you some questionnaires so that we can get an understanding of how it's affecting you in your day-to-day life. In that case history, they may ask you questions about how long you've had hearing loss, if you've worn hearing aids before, if you know what caused your hearing loss, and also some other symptoms that you might experience, like ringing in the ears, pain in the ears, or dizziness. But as important, the audiologist will also ask some social and personal questions about you and your day-to-day life. We may want to know what you do for work, who you live with at home, and how your family support is. We also want to know about your hobbies and activities, if you like to exercise or if you go to groups or church sessions. And then we'll want to understand how the hearing loss has impacted you in all of these different aspects of your life, so we can give you an idea of how the cochlear implant may help you afterwards. There's also some questionnaires the audiologist may ask you to complete. And like I said, these are trying to give us a better understanding of how the hearing loss impacts you in your daily life. I know this is kind of small, but some of the questions might ask about your ability to communicate with somebody when there's other noise going on, how you hear on the telephone or if you're using a telephone for work, how you hear the TV at home if you're watching with a family member. And so expect that they're going to ask you a lot of questions, all to get this information to help you move forward. They also may administer some general health screeners that are not specific to hearing loss. Some examples are perhaps a cognitive screener or a screener about anxiety and depression, because we know that hearing loss can be associated with changes in some of these other health areas. So you will be asked a lot of questions that are not specific necessarily to your hearing loss. After you go through this sort of interview process with the audiologist, the next step will be to program your hearing aids. So if you own your own hearing aids, I would highly recommend that you bring those to your cochlear implant evaluation appointment. The audiologist will either choose to do testing with your specific hearing aids if they can be adjusted, or they may have clinic-owned devices on hand and ready to test. And the reason that we focus on hearing aid programming so much is, I think if you were going to drive a test drive a car and you wanted to get a new model, you don't want to test drive it with a flat tire. And so we want to make sure that your hearing aids are really functioning at the top of their capacity for us to do this testing, so we can get a realistic understanding of how you hear with them. If you've worn hearing aids before, you may recognize this piece of equipment on the right. That is a system that can actually set a prescription for your hearing loss and then measure if the hearing aids are meeting that prescription. And that way we can be sure the hearing aids are really sending the sound that we want them to, and that they're sounding, or that they have the best sound quality possible for you, so that we can do the testing in the right setting. This here on the right is an example of what the sound booth might look like. If you've been to your audiologist, I'm sure you're familiar with this setting. Usually the testing component of the appointment is everybody's least favorite, because it's really giving you an understanding of how you hear with the hearing aids. And oftentimes, if you've been referred for the evaluation, you may not be hearing as well with them as you used to. And so the testing part can be frustrating, but I promise that it's all for a good purpose in determining if you're the right candidate. So once the audiologist has finished that programming, they'll go into the booth to do the testing, and that will be with those hearing aids they've just programmed, or if you use a different type of device, like maybe a cross system for single-sided hearing loss, they may test with that as well. The testing will typically include each individual ear by itself and then both ears together. And to test each ear by itself, the audiologist may put an earplug or place some static in your other ear during that time. The testing component can take anywhere from 30 to 90 minutes, depending on what your hearing loss is like and on what the clinic's protocol is. But typically the first step of this process is to do just a standard type hearing test, but with the hearing aids on. And the goal of that is to make sure that the hearing aids are giving you better access to some of those softer sounds so that we can do the testing in a successful way. And so what this is showing here is if we do that testing, the soft sounds that you're hearing should move up on that hearing test, meaning that you're hearing soft sounds at a better level than you do without the hearing aids. After they do that, the audiologist will start doing some of the speech testing that helps us determine if you meet the candidacy. And so for this part, you'll usually be seated facing a speaker on one of the walls of the sound booth. And they're going to be playing both speech information and some background noise to help and assess how you're hearing with your hearing aids. First, they'll likely ask you to repeat some sentences. These sentences are very strange if you've been through this testing before, but it's going to be either a man or a woman's voice, and they're reading these sentences that are pretty random. You'll be asked to repeat back as many words of that sentence as you can, and it is okay to take a guess if you're not sure. What we're doing with this test is actually measuring how many of the words you get correct, and so it is okay if you think you heard a word to take a guess. The audiologist will then likely play some noise in the background that will mimic kind of like a restaurant or a party so that we can get a better understanding of how you're hearing when you are in one of those more challenging situations. The next test is typically going to be a test where you'll repeat individual words. And so for this test, it's going to be a man's voice, and he'll say ready and then a word. And you'll just be asked to repeat that word that comes after ready. And for this test, we're actually measuring both if you understand the word and then if you understand parts of the word. And so this is kind of an example here that even if you only hear one or two sounds of the word, we're still counting that, and that can give us a better understanding of what speech sounds you might not be hearing that well. That can help us to know, is it something we could adjust a hearing aid to help? Or is it really just a sound that a hearing aid is not going to give you access to that a cochlear implant will? Depending on your hearing loss, the audiologist may also have you sit in some different positions in the booth, and they may play speech from one side and background noise from the other. So this is why the testing can take a little bit of time, because they're really going to do some different things to assess how you're hearing. So after that testing, a lot of people are wondering, when am I actually going to find out if I met the candidacy? And the answer is you likely should find out immediately after the testing. What the audiologist will do is take your results and score everything, and then they're going to look at all of the information they've gathered that day to try and give you the best answer as to if you're a good candidate. Now, this is only looking from the audiology perspective, so of course we'll have to take into account the medical workup of your ears, your imaging once you've had that done with the ENT, and then all of that information together will tell us if you're approved to move forward with surgery. But with the candidacy, there's actually certain percentages that both insurance companies and the FDA have set for the candidacy guideline. And so the testing is trying to show if you meet those percentages. And so the audiologist will look at all of this and your specific insurance, and that will tell us if you've met the candidacy. Once they've gone through the candidacy discussion with you, then there's a lot of counseling and discussion that will happen about what the expectations are for the device relative to some of the test results in your history. At this point, the audiologist will sit back down with you and also talk about things like how the CI process works, any current research about CI outcomes and how we expect patients will do. And then they'll also review the different device options with you. And if you're ready, they may even pick out your equipment at the cochlear implant evaluation appointment. The cochlear implant process may look a little bit different depending on what center you go to and what their protocols are. But what we tell patients at our center is that after your in-person evaluation, we submit the information to your insurance where they could either approve or deny it, depending on your specific insurance. After the surgery, which is done outpatient, patients typically wait 2 to 4 weeks for the incision behind their ear to heal. And then we turn the device on for the first time, and that's done again with the audiologist. We typically see our patients about 4 times within the first year to program the device and make sure that it's functioning the way we want it to. And so the cochlear implant process does have quite a bit of time commitment on the part of the patient, and that you'll have to travel back to the center and have those programming appointments within the first year, and then typically once per year after the device is up and running. With the activation of the device, we tell our patients that typically it doesn't sound like speech on the first day. Of course, that's our long-term goal with the cochlear implant, is to give you better speech understanding than you can have with a hearing aid. But typically the first time that your brain is hearing with this new sound, it doesn't sound like speech that you remember. Sometimes it will sound like just a beeping sound or a chirping sound. And then over time, as you start to understand speech, it might sound more mechanical or robotic. We've had patients say Mickey Mouse or aliens, but that will start to normalize over time depending on things like your history and your test results. We also review expectations in a lot of detail, and we let our patients know that our expectation is that you'll wear the cochlear implant during all waking hours. So, after the shower in the morning, we want patients to put the device on and wear it until bedtime, because research has shown us that patients who do wear the device all day, every day, are more likely to make faster progress and understand speech at a faster rate than those who don't. And it's kind of like a foreign language that we're teaching your brain at first, because it's hearing this new sound for the first time. And so with time and practice, understanding speech will become easier with the cochlear implant. Once they've talked to you about expectations and kind of what the CI process looks like for that center, they'll likely also talk to you about the different device options that are available. So in the United States at this time, there are 3 FDA-approved companies that make cochlear implants, and those are Medel, Cochlear, and Advanced Bionics. And the audiologist will help you to choose which company is appropriate based on things like your lifestyle and your history that you've provided them. In terms of device options, there are a lot of different wearing styles and kind of ways you can personalize the device for yourself. So you can see here that there's devices that sit behind the ear. There's devices that do not sit behind the ear and it sits completely off of your ear. And there's also ways you can personalize them with things like stickers and different covers so that you're making the device more personal to you. So they'll talk about the benefits of each of these options and styles and help you to pick a device that's right for you. They're also going to talk about accessory options. So these devices, while you may get the processor, also come with a lot of accessories. And those can be things like a hearing aid for the other ear if you're only a candidate in one ear, or if you want to continue with the hearing aid on the other side. There's also devices that look like this, and these are remote microphones that you could maybe give to someone sitting across the table to help you understand even clearer in those background noise situations. This device here is a TV streamer, and that can allow you to send the sound of your TV directly to your devices. There's also waterproofing options for all 3 of those manufacturers. So if you like going to the beach or like swimming, you can still have access to sound while you do that. And then they're also going to review with you things like what type of cell phone you use, because a lot of these devices do have Bluetooth connectivity. And so we'll want to make sure that we're picking a device that's really going to work well with the technology you already might have. And they may also talk to you about different apps that are available, so you can start downloading those things in preparation for your activation appointment. And finally, the audiologist is going to review with you how the cochlear implant is going to impact your lifestyle, and if you need to make any types of modifications to your lifestyle once you have the cochlear implant. A lot of questions that we get asked commonly are things like, can I go through airport security? And the answer to that is yes. With any new cochlear implant device, you are able to have an MRI up to a certain strength. And so that's one new feature of the cochlear implants that didn't exist before. Older technology was not MRI compatible, so that's been a real benefit for patients getting implanted now. You can still participate in different sports and activities, but we may just need to think about how to keep the cochlear implant on during those activities. You're not going to sleep with the device, so they'll talk to you about when you need to take the device off and charge it. They'll talk about listening to music with the cochlear implant, which I give this exclamation point because typically music is challenging. The devices were originally developed to help get better speech understanding, and so music can be a bit more difficult. And then the cochlear implant likely will connect to your cell phone. And like I said, they'll talk to you about what specific device you have to try and make that easier for you. A lot of patients ask, so if I go through this whole process and I learn about the implant, I do the testing, do I have to get surgery? And the answer is absolutely no. This whole process is completely elective. And so no evaluation is really a bad evaluation. We want you to come in and learn about the candidacy and see if you are a candidate, but that doesn't commit you to the surgery in any way. Whether you choose to move forward is entirely up to you and your family and what's best for you. You know, kind of the best case scenario, if you want a cochlear implant, is that you come in, have the testing, and you're a candidate and you proceed. But let's say that you're not a candidate, or maybe you even are a candidate and decide you don't want to move forward. Worst case scenario, you learned the information, probably got to try new hearing aid programming, and could at least make an informed decision about what's best for you. And then a lot of patients ask, you know, maybe hearing aid patients, what if I haven't been referred, but I feel like I should be? The first step I would say is ask your audiologist and your ENT and kind of be a self-advocate to get yourself in for the evaluation if you feel that it's necessary. And if your ENTs or audiologists are maybe hesitant, it's always okay to seek a second opinion with a cochlear implant center. The American Cochlear Implant Alliance has a lot of great resources for potential candidates of cochlear implants. This website being one of them that has a really nice step-by-step flow of the process of getting a cochlear implant. And then if you go to the American Cochlear Implant Alliance website, up at the top, you'll see this Find a Cochlear Implant Center. If you click on that link, it will take you to a map of the United States. And then depending on what state you live in, it will give you a drop-down list of all of the cochlear implant centers in that state. So if you feel like you want to be evaluated or you want to be referred but haven't been, please feel free to use this resource to find a center in your area. Okay, well, I thank you all so much for joining this afternoon and for listening to this talk. And I'm absolutely happy to answer any questions about the cochlear implant evaluation process.
Thank you, Dr. Smeal, for that wonderful presentation. We will now take your questions, and please remember to submit them via the Q&A feature.
And also here are some more of the ACI Alliance resources that I'm just going to leave up if you want to take a look at these.
I actually have a question, if that's okay.
Sure.
Get
Yeah,
started.
absolutely.
I just want to say first off, thank you. It's hard to talk about all this stuff. So absolutely appreciate you for just being so clear and just, yeah, absolutely appreciate you. This is a question I get a lot in an adult ENT setting is there an age limit in terms of when can I get a CI?
That's a really great question. In terms of an upper age limit for adults, there isn't. I think the oldest patient that I've seen who got a cochlear implant was 94, but we've certainly seen older than that. It really just depends on sort of the health and condition of the patient, and if they get medically cleared. They could always ask their primary care physician or, you know, internal medicine physician, whoever they see, if they would be medically cleared to undergo a procedure like that. And then if, you know, maybe there's a special health condition, they could always consult with a specialist to get that medical clearance to go under anesthesia. But usually the surgeries are done with general anesthesia. So as long as you're safe to do that, there really is no upper age limit.
Yeah, the oldest one I've seen was 102 years old. So I was like, you go rock star.
Yeah. And, you know, it can be life-changing technology even for patients up to those ages. So, you know, don't let that be a limiting factor.
Thank you.
There is a question in the chat. It's they're asking what percentage of hearing loss qualifies for a CI, and is there anything in particular that would disqualify someone?
So when we're looking at what maybe allows you to meet the candidacy. There are certain ranges of hearing loss that we have to look at. More traditionally, it was if you had severe to profound hearing loss, but like I said, you can even have normal low frequency hearing loss now. We don't necessarily classify hearing loss as a percentage. It's more based on the degree of hearing loss. And then when we're looking at percentages for the testing they'll do with your hearing aids, there's a certain percentage that we're looking to meet in doing that as well. So that's where the audiologist will make some decisions about testing with background noise or different scenarios to see if you would meet those specific percentages. And it does vary a little bit based on your insurance. And then in terms of things that would maybe limit you from qualifying, I would say it sort of depends on your history, your hearing loss. And then a lot of times, unfortunately, insurance can be a limiting factor if you don't meet the specific guidelines that your insurance has set. But we always try to work with your insurance and, kind of talk them through why we think that it's the right option if we feel that it is for a patient.
We have another question. This is from Meredith. They asked, who picks the company that the patient will be implanted with?
That's a good question. So I think that can depend a little bit on the center that you go to, whether they offer all three of those companies or maybe only one or two. But at our center, we like that to be a joint decision between the patient, their family, the audiologist, and the physician. And we really try to let the patient and their family have a majority of the say if they feel that one would fit their lifestyle better. There are rare cases where the physician may recommend a certain internal implant, but those cases are very rare. And so oftentimes the patient has the option to choose from all of them, and we'll kind of guide them through that process.
There's another question. What about updates and upgrades to the technology?
Mm-hmm. Good question. So with the external equipment or the sound processor, that technology gets updated every couple of years by the companies. And in order to upgrade your external technology, you do not have to undergo another surgery. You'll just submit that information to the company and say, I'm ready to upgrade. And then they'll work privately with your insurance to see if that upgrade gets approved, and typically it will. And so then you just bring your new equipment in and the audiologist will program it, but it doesn't require a new surgery to get your external equipment upgraded.
I have another question. You mentioned some of the newer technology is MRI compatible.
Mm-hmm.
So in those cases, there still is a limit on it. It's just some of them are works with it. So can you talk a little bit about that?
Sure. So all three of the cochlear implant companies at this point have an MRI approved device. Depending on which device you have and which manufacturer you have, the specifications can differ a little bit, but I would say typically it's approved up to 3.0 Tesla, which is the strength grading for MRIs. What I always recommend to my patients is just to be, comfortable and confident that you're okay to undergo the MRI. Always consult with your physician first and make sure that they approve. And then typically the radiologist would like to know that you have the implant as well in case there's any modifications they have to make. And certainly if you have an existing device, this has only been approved for a couple of years, so older devices would still need more modification. So I think it's always best to just check with your ENT before you undergo imaging.
Oh, that's great. And also when you mentioned the music, that is, you put a question mark, that's real interesting because I feel that a lot of the cochlear implant wearers do enjoy music. So it's really interesting that it's how it's, I guess, up to each person's experience. That is really stuck out to me.
Yeah, I think, with music, it's a lot more complicated than speech because there can be so many different instruments and sounds and qualities that sometimes the implant isn't able to kind of process that information as successfully as maybe speech. But a lot of our patients do get really good benefit with music and actually love how music sounds with their implant. I think from what I've seen, it typically just takes a little bit more time for that appreciation to develop than it may for, just basic one-on-one speech.
That's excellent. Yeah.
Yeah, and just to add on to that, I'm 25 years old. I got my implants when I was 2 years old. So it's taken me a very long time to really appreciate music. And now I love going to concerts. I love it all. I'm able to follow along. It does take a very long time. Even when I'm learning new lyrics or new songs, I still gotta look at the lyrics and be like, okay, it takes me a couple times to be like, oh, they're singing whatever song I listen to. So it does take a while, but I absolutely love it, especially with the Bluetooth. Best thing ever, because people are trying to talk to me and I'm like, 1 second, I'm listening to music. They're like, oh, that's so cool. You're like a spy. And I'm like, okay.
That's
it really does like turn it into your own personal Bluetooth headset. I think with patients who maybe had hearing loss that progressed over the course of their lifetime, who have listened to music with normal hearing before, what we tell them is start by listening to music that you're familiar with, that you already maybe knew the lyrics to and know what it sounds like, to start training your brain to hear music with your implants.
That's a great strategy for rehab. That's awesome.
That's great. Well, if there's no other questions, I would say thank you for attending the Tuesday talk. Oh, wait, I think there's another one coming in. Sorry. So many patients are scared of losing hearing in the surgery. What would you tell them?
Yeah, that's a good point. I think that's something that a lot of patients maybe hesitate about, and that might be a reason or a kind of limiting factor in them proceeding with the surgery. I think it depends a little bit on how much hearing you have in that ear, but typically if you're meeting the candidacy criteria for an implant and your audiologist is recommending it, what we expect is that even if you were to lose that hearing in your ear after surgery, that your understanding of speech with the cochlear implant is going to be better than what you get with the hearing aid, even with that hearing that you still have in that ear. Usually by the time you're being referred for a cochlear implant evaluation, even if you have some hearing left in that ear, it's likely not giving a lot of speech understanding or really supporting you in your day-to-day. And I would also encourage, people who are afraid of losing their hearing, that there's a lot of new surgical techniques. The surgeons can use new implants that are thinner and that do less damage to your hearing. And so a lot of times we're seeing that the hearing can actually be preserved in the ear that gets the implant. So that's one part of cochlear implants that has changed a lot in the past couple of decades. And I think it can be scary to think about not having your hearing in that ear, but I would encourage that if it's being recommended, we expect the implant will give you better speech understanding than you could get with that natural hearing. Oh, is there another? Let me see. Right.
Those two were together.
Okay.
Okay. All right. Well, thank you for attending a Tuesday talk. Please visit our website to register for upcoming dates.
Okay.
And then here's just one final reminder about our available website resources. So thank you guys for all joining us. This was so awesome, and we so appreciate you, Molly.
Yes, of course. Thank you guys for having me.
Thank you all for attending the webinar. This ends the webinar. Thank you.
Thank you.